Hi, I'm Dr. Sylvia. Welcome to your GP consultation, Vlogmas Day 7. Here we provide expert women's healthcare services, which you can get all from the comfort of your own home. So visit us at yourgpconsultation.com. You heard of Nutcracker syndrome? It's a rare vascular that's related to blood vessels condition, but for those affected, it can cause significant side and pelvic pain or discomfort. It can also lead to having blood in the urine, painful sex, or in men, swollen testicles. Today, we're unpacking what it is, its symptoms, and the latest treatment options. So let's start with what is it? Well, Nutcracker syndrome gets its name from where the left renal vein, which is one of the main blood vessels from your left kidney, is squeezed or compressed. It's typically squeezed between two arteries, the big aorta that runs down the middle of your abdomen and one of its branches to your intestine, much like the way a nut is cracked in a nutcracker, hence the name. Now, this compression or squeezing of the vein increases pressure inside it and leads to a variety of symptoms. The most common include flank pain, which is usually felt on the left side, blood in the urine that you can see with your eyes or with a microscope. In men, they get something called varicocele, where they have enlarged veins in the scrotum. In women, pelvic pain, painful periods, or pain during intercourse. These can be related to a condition called the pelvic congestion syndrome. Other symptoms like extreme tiredness and nausea can also occur. So how do we diagnose this condition? Well, it often starts with tests like ultrasound, CT scan, MRI scans to identify the condition. The confirmatory test is a special type of X-ray that uses a special dye to visualize the vein and measure pressure, called a venogram. Treatment, well, depends on how severe your symptoms are. Here's a breakdown of the options. First, the non-surgical or conservative management. Now, this is the first line for mild symptoms, especially in children and teenagers. It includes getting pain relief, weight gain if the person is underweight, and monitoring, because the majority of young people see spontaneous improvement within 2 years of this condition being diagnosed. Now, there are surgical options. These are considered if symptoms are severe or they persist beyond the 2 years I just mentioned. That compressed vein is re-implanted to relieve the pressure, or a stent is used to keep the vein open. In some cases, the left kidney may be transplanted to another location, but this is reserved for severe cases. What's the key takeaway? If you have persistent, unexplained left-sided flank or pelvic pain, especially if you're developing blood in your urine, discuss Nutcracker syndrome with your doctor. A correct diagnosis is the first step to effective management. So, I hope this helps demystify this rare but complex condition with such an interesting name. If you found this video helpful, share it with somebody who you think might just need to know about this. Subscribe for more health information, and I'll see you soon for another Vlogmas health tip. Happy holidays from your GP consultation and Ask Away Health.